So over here, basically, we are considering the bite marks that are the mainstay of forensic odontology. When we are defining forensic odontology, it's basically the branch of forensic medicine that deals with the study of dentistry, or that deals with the study of the dentition. So it's again very important to compare a normal dentition, and how do we compare it to the dentition of the suspect in a lot of cases. And whenever we have bite marks at our hand, when we are carrying out an autopsy and we see a bite mark, we can basically compare the dentition to the dentition of a list of suspects that we have at our hand, and we can identify the suspect quite accurately in a lot of cases. So it's again very important over here. And even though if we don't have complete bite marks identified, but still if there are fading bite marks found at a dead body, we can get the DNA or the saliva, and that is again very critical for a lot of investigations, and we can again match it to the DNA or to the DNA of the list of suspects. So the personal identification lies, it lies on the knowledge of forensic dentistry that we have to have as a forensic pathologist. So the bite marks, they are going to be discussed over here. The bite marks on the food items, specifically if we have a lot of suspects, their dentition marks have to be taken on a lot of food items. We can take it, for example, gum acacias are used for this purposes, and that basically provides us the details of the dentition of the suspect, and that will be again compared to the bite mark on the victim. Human bite marks in sexual assaults are again very common, and whenever a sexual assault is carried out, or there is any history of sexual abuse, and we are suspecting that this particular murder is due to a sexual assault, we'll completely examine the body externally. And upon a complete examination, sometimes bite marks are going to be revealed in a lot of cases. Sometimes the bite marks are not evident on the fresher bodies, and you have to wait for some time to get the bite marks in a more clearer form. Then there are the instances bites, and that will also be discussed over here in this first section. So primarily we are talking about forensic odontology over here, a discipline in itself, and requires a special dental expertise not possessed by the pathologist and is qualified only in medicine. So sometimes when you're working as a forensic odontologist and you don't have one expert opinion at our hand, we can even consult the dentist, because they have a lot of knowledge of the dentition and they will guide the investigation in a proper way. Whenever we are talking about this forensic odontology, we have to keep in our mind that the examination of the subject is usually carried out in situ. That is, we have to completely examine the dentition while the body is on the autopsy table. So this is basically called as the in situ observations that are being carried out. Then the assistant dentistry that basically renders a lot of help in this case. The interpretation of the bite marks is again very important, because the dentists have a complete knowledge towards the dentition and how to basically determine the age of the person, through just inspecting the dentition of a person, and also just to explain what is the gender of the individual in a particular case. And then we also have to personally identify the person or the dead bodies in a lot of cases. So even for this personal identification, we have to qualify and we have to write down in an autopsy report what is the probable gender of the person, what is the probable age of the person. So all of these is the basically important information that is going to conclude what is the personal identity in a particular case. The individually or in context of the mass disaster. So even we find people individually that are not identified when they are dead. And even we have mass disasters, for example, the bomb blasts, even a lot of earthquake, basically it shatters a lot of people. So we have a lot of bodies which are unidentified. For example, in plane crashes, in these incidents, basically we have a lot of bodies at hand, and we have to identify personally which person belongs basically to the remains. So we'll identify through all of these phenomena. And whenever we are considering the bite marks in detail, basically it gives us an interpretation of trauma to the body. Here we'll have to basically suspect whether it was an accidental trauma, it was a suicidal, or it was basically a homicidal intent of the trauma. So the medical legal aspects are considered over here, and the bite marks on the inanimate object or the food are taken for the suspect and is then compared with the bite marks that were present on the victim. The dental evidence is basically used if you have the dental record of a particular suspect, then you can compare it to the bite mark that is present on the victim. The identification of the preparators of the crime, it's again very important, and the teeth marks in some substances that are left at scene. So that is basically going to give you an evidence about the suspect. We can also consider the saliva that is present on the bite marks, and the swabs are taken and they are sent to the histopathologist for considering the DNA analysis. The bite marks are taken on the food items. Their preservation of the bite marks is done, and if the plastic substance is stored in the refrigerator, it prevents the gradual flowing. So this is basically the whole method and the precautions that have to be taken. It is not deep frozen, and basically it causes the brittleness in this case. The histological formalin is used for just fixing the bite marks, and it is quite unsatisfactory in a lot of cases. The substances used for this bite marks that are taken on the food items, and that are basically taken for comparison which is made on the body on which the autopsy is being performed. So 5% acetic acid is taken, and it is taken in 40% aqueous formaldehyde solution. So this solution is going to fix the bite marks that are taken on the food items. The swabbing is taken for the saliva traces, and these swabs are then sent for the DNA analysis, also for comparison purposes. The bite marks on the human body are relatively common, and they are important evidence whenever we are suspecting a case of child abuse. So it can be anywhere on the infant, and arms, hands, and shoulders are the most favorable areas involved in this child abuse cases. These bite marks can be self-inflicted in a lot of cases, and the examination of the bite size is again very important. The size is usually consistent with the adult dentition, and it has to be distinguished from the bite from a child. So we have to basically distinguish whether this bite mark was caused by a child or it was caused by an adult. So this is quite a simple distinguishment that is made over here. In rape or in sexual offenses, these bite marks are quite common. Sexual murders are again a very common phenomena seen. Examination of the bites as part of the autopsy. So usually the sexual murders or the bite marks that are involved for the sexual assaults are of this kind that is shown over here. It is usually a bruising phenomena that is seen due to a negative pressure that is built up due to the suction phenomena. So these bite marks have to be distinguished over here as well. Assessing the live victims of the assault, they're again very important, and we have to basically clinically examine the victim in detail, and then we have to have the comparative studies along with it. The bites are usually sexually oriented in this case, and the location on the number of bites is noted down while you're writing down the autopsy report or while you are clinically examining the victim herself. The type of crime is also noted down, and we also have to detail the age of the victim. The common sites are usually that are involved in the sexual assaults are the breasts, the nipples, the pubic area, the neck or the vulva, etc. Then there are also the instances bites, and they're usually when there's a particular instant. For example, they are inflicted on the police officers whenever they are arresting the suspects. In sporting events, and the main targets are usually the hand, lips, and ears. And there can be the self-inflicted bites as well on the other hand, for example, by falling onto the face. So the multiple bite marks are usually the suction type, and they usually involve the shoulders and the arms because these are the more accessible areas in this case. So basically in this section, we dealt with the different kind of bite marks that we can come across and what can be the medico-legal aspects to these bite marks. That is the end of this section. Thank you for watching sqadia.com.